Smoking and tobacco, they are injurious to health. Every person who has this habit has considered quitting at some point of time or the other, is that they don't know how to quit, that there are medicines which can help them quit, but they don't know whom to approach when they want to quit. Patches or with chewing gums, it will be very easy for you to quit the harmful part. Hello, I'm Dr. Avinash Chaitanya, head and neck surgical oncologist. Today I'm going to tell you about an important health hazard that we are all facing in this present time. We know that smoking and tobacco, they are injurious to health. Everybody knows, every person who actually consumes these products knows they are harmful for them, but they still do it. I'm sure every person who has this habit has considered quitting at some point of time or the other, but has continued with the habit despite it. The reason could be many. One is that they don't know how to quit. They don't know that there are medicines which can help them quit. They know that they want to quit, they know it's harmful, but they don't know whom to approach when they want to quit. One of the best ways to quit is to stop buying. You may feel the urge to use it or the urge to smoke, but if you don't have it, you may slowly stop it. The other thing that you can do is to have nicotine replacement. The active component in smoke or tobacco, which is actually causing the addiction, is the nicotine part. So if you have a replacement with patches or with chewing gums that are commercially available, it will be very easy for you to quit the harmful part, which is the cigarette smoke or the tobacco chewing.